So it's fairly common to be nervous on the day of surgery. Most patients though can decrease that anxiety by having a brief understanding about what to expect on the day of surgery. So most people have to fast before surgery, which can be an unusual step in their morning routine. So that means no drinking and no eating for at least 6 hours beforehand. When they come to the hospital, it's often being dropped off by a friend or a relative, and that's simply because after an anaesthetic, there's a legal requirement that they can't drive themselves home. Once you arrive in a hospital, we go through the admission process, and so the administrative staff will take you through all the paperwork that you may not necessarily have filled out prior to your surgical date. And then you get brought up to either the day ward if you're a day case, or the ward if you plan to stay overnight. So it's completely normal to spend some of that time waiting, so feel free to bring something to read, something to do while you're waiting, because it can be quite a reasonable time. Once we call for a patient, then we get brought down to the operating suite where you're held pre-operatively. Once we've done all of our checks by the nursing staff, the anaesthetist, the surgical assistant and the surgeon, then you'll be brought through to a theatre like this one. Inside the theatre there are a few bits of equipment. Part of those equipment are for your safety, and part of those equipment is to keep you asleep while we perform the procedure. So there's a combination of different types of anaesthetics we use. One is to make sure that you're asleep and unaware of the procedure as it's going through, and the others are primarily related to your pain relief afterwards. A lot of the equipment around the periphery is used to perform the operation, whatever that operation is that you are indicated for. And depending on the length of the operation, the complexity of the operation, the goals of the operation will depend on how much equipment is required. Each patient has equipment-specific requirements, and those are the things that we check pre-operatively. During the operation, there are a lot of things that are going on simultaneously, and so there are several nursing staff involved. There's an anaesthetist that will monitor you while you're asleep. There's a surgical assistant who will be helping myself or your chosen surgeon with the procedure. And then post-operatively, that same team will help wake you up before taking you through to recovery. Recovery is where you wake up in a safe environment with people who are specially trained in that endeavour. You normally observe there for a period of time until you are safe enough to be taken back to either the day suite or the ward, after which myself or your chosen surgeon will catch up with you, explain what we've found, walk you through the rehabilitation, and answer any questions that you have.